What happens during an incisional lymph node biopsy for lymphoma? Imagine a doctor trying to figure out if a swollen lymph node is caused by lymphoma. One way they do this is through an incisional biopsy, which is a careful way to get a tissue sample. This procedure is often used when the lymph node is enlarged or in a tricky spot where removing the whole node isn't safe or practical. The goal is to collect enough tissue to make an accurate diagnosis. First, the doctor will prepare the area. Usually, they give local anesthesia, which numbs the skin and tissues around the lymph node. Sometimes, if the lymph node is deep or hard to reach, they might use general anesthesia to put the patient to sleep. Once the area is numb, the surgeon makes a small cut in the skin over the lymph node. The size of this cut depends on the location and size of the lymph node but is generally just enough to access the tissue. Using fine surgical tools, the surgeon carefully removes a small part of the lymph node tissue. This is called an incisional biopsy because only a portion of the lymph node is taken, not the entire node. The tissue is then sent to a laboratory for analysis. There, a pathologist examines the sample under a microscope, looking for abnormal lymphocytes or other signs of lymphoma. Additional tests like immunophenotyping or genetic analysis may be done to identify the specific type of lymphoma and its characteristics, which helps guide treatment options. The incision is then closed with stitches or surgical tape. The whole process usually takes about 30 minutes to an hour, depending on the location and complexity. After the procedure, patients might feel some discomfort or mild pain, which can often be managed with over-the-counter pain medications. Minor swelling or bruising around the site is common but usually resolves quickly. Risks are generally low but can include infection, bleeding, or scarring at the biopsy site. These are rare and usually manageable with proper wound care. The tissue sample obtained during the biopsy provides enough information for doctors to confirm whether lymphoma is present, what type it is, and how aggressive it might be. This information is vital for planning the most effective treatment. In summary, an incisional lymph node biopsy is a safe and effective way to gather crucial information about lymphoma. It involves making a small cut, removing part of the lymph node tissue, and sending it for detailed analysis. Most patients recover quickly and find this procedure to be a key step toward understanding their diagnosis. Remember, always consult healthcare professionals for personalized advice and treatment options.